Studies have shown that eating white-fleshed fruits like apples lowers the risk of stroke. Antioxidants in apples can help prevent blood clots, relaxes arteries, and increases blood flow. Apples and bananas are also a rich source of potassium, which can further help reduce blood pressure. Lower blood pressure means lower risk of stroke. Increased sodium increases the blood pressure. Blood vessels get tightened and narrowed, resulting in increased blood pressure, which can lead to stroke. Less salt means lower blood pressure and less risk of stroke. Stroke is one of the leading causes of deaths globally. So what are the risk factors for stroke? First thing first, high blood pressure. Hypertension. Normal blood pressure is 120 by 80 millimeter of mercury. High blood pressure damages the blood vessels, and small blood vessels in the brain could bleed and result in hemorrhagic stroke. It also results in formation of blood clots. It's very important to keep your blood pressure in check, and if you have higher blood pressure, you should seek medical attention. Start lifestyle modification like limiting the salt intake, as salt increases the blood pressure. Improve your hydration level, as it helps with the dehydration and also lowers the blood pressure. But if the lifestyle modification it is not getting settled, do seek medical attention to avoid the risk of stroke. High cholesterol level or hyperlipidemia. The level of low density lipoprotein is very important. Low density lipoprotein increases the risk of stroke. So avoid fatty processed foods because they can generate a dangerous phenomenon called atherosclerosis, that is thickening of blood vessels, which result in impaired blood flow, formation of blood clots, and it can lead to stroke. So eat cholesterol lowering food rather than fatty food. Diabetes means not having enough insulin to absorb glucose. So excessive blood glucose in the blood vessels for a longer period of time can result in fatty deposits, clot formation, and result in blood clots, which can result to stroke. So limit your sugar intake. If you are diabetic, control your blood sugar levels by lifestyle modifications. Heart disease and stroke are closely related. Coronary artery diseases increases the risk of stroke as plaque builds up in arteries and blocks flow of oxygen-rich blood to the brain. So it's very important to keep your heart healthy to avoid risk of stroke. Smoking. Smoking reduces oxygen in the blood. Tobacco contains over 4,000 toxic chemicals which get deposited in the lung, damages blood vessels after absorbing in bloodstream. So quit smoking now to reduce the risk of stroke. Alcohol consumption. Excessive alcohol consumption increases risk of hemorrhagic and ischemic stroke. It causes irregular heartbeat called atrial fibrillation and formation of clots to the brain, which can lead to stroke. So it's very important to limit alcohol intake. Obesity means having too much weight. Increases risk of high blood pressure, heart diseases, high cholesterol level, type 2 diabetes, which all contributes to high risk of stroke. It is very important to have physical activity. It lowers blood pressure, which is an important risk factor for stroke. You should be as active as possible in daily life. At least 30 to 45 minutes of walk daily is important to avoid the risk of stroke, as it will lower your blood pressure and other vitals. Stress and stroke. People with high stress doubles the risk of stroke. Stress increases the BP, sugar levels, fat levels, resulting in clot formation, causing stroke. So strokes are preventable. All we have to do is to have healthy lifestyle modifications and to keep our health in check. Prevent strokes before it strikes. Eat healthy. Stay stress-free. Quit smoking. Keep calm and carry on.